Okay, welcome back everybody. This is Dr. Scott Peters, your friendly neighborhood foot and ankle specialist. Top 5 questions of the week, and these are questions that my patients have asked me during the week, and so let's get started. Okay, first question number 1. What's the difference between a podiatrist and an orthopedic surgeon? So it's a good question. The basic difference is the training and the education. When I was younger, orthopedic surgeons were known as bone doctors. That term is kind of, it's a little bit passé now. You don't hear that term so much, but they operate on anything, any broken bones in the body, any injuries, anywhere. And so they have a very well-rounded education, and podiatry is much more focused. It's strictly on mostly ankle and foot. So while orthopedic surgeons would think that they have the advantage over us, we think we have the advantage over them. Their advantage is that they do a lot more orthopedic surgery on shoulders and hands, upper extremity, the entire body. And our training is focused on the area that we're going to be practicing on when we graduate from our residencies. The reason we feel we have an advantage is because that's all we focus on. So we know it inside and out. And we feel like, they have a nice, well-rounded surgical approach and insight and techniques, but we feel ours are a little better. To advocate for our profession, podiatry, I'll tell you that I've done my orthopedic rotations in my residency, and I think our surgical technique is superior. I saw a lot more infections when I was doing orthopedic surgery with the orthopedic surgeons, a lot more skin complications and things like that. And in fact, I remember there was a time when they would admit patients post-operatively for pain control following something like a bunionectomy or hammer toes, and I don't even prescribe narcotic medication or pain medication after those procedures. So I think a lot is the surgical technique. I think we tend to be a lot more meticulous. It's nice for them. They can make an incision all the way down to the bone and open up a joint and replace the joint. We tend to dissect in layers, and we're very meticulous at how we repair those layers afterward, and we think that's a far better approach. But look, there's great orthopedic surgeons, and if you need a knee fixed or a hip replaced, that's who you go to. But personally, I trust you in my hands better than I do in the hands of an orthopedic surgeon when it comes to foot and ankle. So question number 2 is, what makes you stand out above your competition? So first of all, I don't tend to think of other doctors as my competition. I mean, thank God we have a lot of good doctors out there, and everybody brings something to the table. Chemistry between patients and their doctors is very important. I think I have a tendency to be a very good listener, and I think it's a very important skill for doctors. It's very easy for somebody to walk in with a certain complaint. For example, my heel is killing me. A lot of doctors make a snap decision, and it's plantar fasciitis, which is probably the most common cause of heel pain. And so a lot of times that's a mistake, and you can treat that in ongoing fashion with no success because it was a misdiagnosis. I tend to listen very carefully to my patients. I tend to develop a very nice relationship with my patients. I literally feel like my patients are my family and my closest friends. I have patients that send me text messages and send emails to the office wishing me happy holidays, and they send it with all their love, and it's very mutual. So I think that is something that helps me stand out amongst other podiatrists. And at the end of the day, a lot has to do with how good are your hands and how much do you know, and how well can you explain things to patients. And so if surgically you're not strong, it's going to show in your work, and you're going to have unhappy patients. And even in the office, small procedures, injections and things like that, you have to be able to do that in a comfortable way. Your patients don't say, I'm never having that done again. So I think I provide my patients with that. That tends to be the feedback I get. And so I would say that's what some of my strengths are. And now question number 3. How do I know if I have a sprained ankle, and what can I do without going to the doctor? If you hurt your ankle and you're having trouble walking, you should probably get it checked out. But let's say it's over the weekend and you're not going to find a doctor open anyways. The first thing you do is you get some ice on it, get it elevated, put some compression on it. While you're icing it, is a good idea to put an ACE bandage around it so you can get some compression. Keep it on there for 20 minutes. And when you get done, have in mind that you're going to do this again. An hour later, there's an old physical therapy modality where 20 minutes on, 20 minutes off. That's great. I just don't know how realistic it is. I mean, I know if it was me, I wouldn't have time to do it 20 minutes on, 20 minutes off, 20 minutes on. It's not feasible. So I usually tell people if you can get a minimum of 3 times a day for 20 minutes, that's therapeutic. If you can do 5 to 6 times, it's better. The ice should go in a bag directly on your skin. There are some exceptions to that. If you have peripheral artery disease, meaning if you don't have adequate blood supply to your feet, you don't want to put ice on them, which will constrict the blood vessels, and then put an ace bandage on it, which will apply compression, and then elevate it so gravity is working against the blood flow. That probably wouldn't be the smartest thing to do. But for the average healthy person who's out playing sports and that's how they sprain their ankle or injured their ankle, that would be the thing to do. And then if you did that for 2 days and you're still having trouble walking, then you definitely have to make an appointment and be seen. Typically, when we discuss sprained ankles, we're talking about one of 3 degrees. And you could call it 1st degree, 2nd degree, 3rd degree, mild, moderate, severe. The mild involves one of the major ligaments on the outside of your ankle, and the 2nd degree sprain involves 2. And 3rd degree sprain obviously involves all 3 of what we call the lateral collateral ligaments, which gives stability to the outside of the ankle. The overwhelming majority of the time when athletes or any patient injures their ankle, it is the lateral side, the outside. And so it involves one of those 3 ligaments. I can't tell you that one necessarily takes longer to heal. You can imagine that if all 3 of the ankle ligaments tear, as opposed to just kind of straining 1 or 2 of them, you might have a quicker return to activity in the non-torn injury. Usually in 4 to 6 weeks, you can be back to normal activities and some light workout, maybe back to full activity if it's even if it's a severe sprain. But the big thing is, a lot of times, even if you don't break your ankle, when you roll your foot in an ankle sprain, a lot of times the base of the 5th metatarsal will break. And sometimes people don't even realize that that's hurting them that much because it just kind of feels like the outside of their ankle. And so if you don't get x-rays on both, you could easily miss that injury. And that is not a fun injury to recover from because the results are highly variable and the amount of time it takes to get the bone to heal is highly variable, and it could be easily 12 weeks. And nobody wants to miss their activities, whatever their exercise is or their competition is, for 12 weeks. That's a long time. Question number 4. A lot of people ask, how do I know if I have a stress fracture? Well, that's a tricky question because without an x-ray, you really don't know. What makes it trickier is that even with an x-ray, the x-rays are not always so honest when it comes to stress fractures. A lot of times, a stress fracture will lag behind anywhere from a week to 2 weeks, and you won't see it. And so what are the symptoms? Usually a stress fracture, the more you're on it, the more pain you'll have. It's not one of those things where, you get up in the morning and you step down on it and it's agonizing, but then it gets better as you start walking on it, loosens up. Stress fractures typically behave very consistently. The more you're on it, the more it hurts, and eventually it kind of sits you down. So that's a fine point that might clue you into whether you have a stress fracture or what we call a frank fracture, a full fracture right away. Typically, they're easily treated. If you immobilize the patient in a cast or in a fracture walker, which is like, you've seen these boots, they look like space boots with Velcro straps. So usually if you can put somebody in there for 4 to 6 weeks, your garden variety stress fractures will heal pretty well and people can go back to activity. They don't typically require surgery. However, if you have a stress fracture and it goes untreated, meaning you don't immobilize it, you don't stay off it, a lot of times they will break and then it can displace. And so if a bone breaks like this, or like this, it'll heal. But once there's a gap in a different direction, or it's elevated or it's lowered, so that is not a guarantee. And a lot of times we'll have to go in there and put a plate on there with some screws to get it to heal. And that's a whole different animal. Okay, question number 5, last question of the day. I'm getting a lot of questions about neuropathy. I don't know if it's being marketed, maybe by one of the companies that produce medication for it, but a lot of patients come in and they're just suffering from foot pain and they say, I think I have neuropathy. Neuropathy historically was not really painful. It was numbness. It was the feeling that your foot was dead or sensation was diminished, kind of like if you went to the dentist and you got some anesthesia in your mouth, you can feel your lip, but you can't feel it. You don't feel yourself touching it. That's what neuropathy typically felt like. In the last 15, 20 years, there's been more patients with neuropathy that is painful and it hurts. And so that's a little bit different. And there's a number of different reasons or causes for neuropathy. Probably the single most common cause of neuropathy in patients that I see is either diabetes or what we call radiculopathy, which means it's coming from impingement somewhere in the spine. Most people think if they have an impingement in their spine or where there's compression from a disc, a bulging disc, a herniated disc, that you would feel it at that spot or down into your seat. However, that's not necessarily the case. Nerves carry impulses, and a lot of times people don't even realize they have a back issue, but they feel it in their foot or in their toes. And so that's something that usually I would send somebody to a neurologist and have them work them up. There's certain tests that we can get to find out what is causing it and where it's being caused. So there's also peripheral neuropathy that occurs because there's an injury, some kind of injury or impingement on a peripheral nerve. Sometimes a nerve gets caught up in a scar or in scar tissue. Somebody might have suffered blunt trauma or surgical trauma from a scalpel, and when it heals, a nerve can get caught in the scar, and that'll cause neuropathy, burning, electricity, jolts, numbness. Once that happens, there's different ways to treat it. Sometimes you can take an anti-inflammatory medication and the problem goes away. And sometimes you need a couple rounds of it and it'll go away. In fact, I would say probably most of the time. But other times you need to inject it with a steroid, or sometimes you even have to make a surgical incision and address it surgically, free up the nerve, and then the nerve will return to normal function. Nerves are funny though. You can have a short-term impingement on a nerve or damage to a nerve, and it could be a permanent problem. It could stay with you the rest of your life. And you could have something that has been bothering you, there's been impingement on a nerve for years, and the patient never did anything about it, and as soon as it's treated, it's gone, and that's it. So there are medications to treat neuropathy today. There's several different medications to treat neuropathy. There's a lot of natural supplements being pushed in the marketplace, and the response is always the same: it didn't do anything for me. So there's also compounding pharmacies that are making mixtures that are topical, so you don't have to ingest them. The truth is they do get introduced into your body through your skin anyways, but some of those I've had success with, and I've seen patients that have come in and they make multiple requests for them because it does provide relief for them. So I think that's a better option than the nutritional supplements. The medications themselves, I'm not even a big fan of the major ones. So there's 3 generations of medications that have been used to treat neuropathy. I would call the first one tricyclic antidepressants. Those used to work very well until the second generation came out. And then somehow the first generation fell off the map, even though they were very good and they were relatively safe. I don't ever remember having patients that had problems with them, but everybody got excited about the new medications, which were anticonvulsants. And those medications, I don't know that I found them to be as effective, and they're kind of heavy-hitting drugs. So I tell patients, if you've been on them for 6 months and you're maxed out in the dosing, if it's not doing anything for you, you really should come off the drug. You do not need that medication in you. And for whatever reason, primary care doctors, when they're right for them, a lot of times they'll tend to forget that they're on them and forget to check if they're doing better. If the patient's not complaining about it, they don't think to ask. And my biggest concern when it comes to treatment of neuropathy, if you're on a medication for it and it's not providing you with relief, just get off it. The third type of medication that we use for the treatment of neuropathy is, I believe it's called a medical food. And it is a combination of different vitamins, and it's a supplement. And there's been a lot of success with that medication. I've had plenty of patients who do much better on that. It is probably more related to the reason for the neuropathy, but I have had patients with back pain that has ended up in their foot causing them neuropathy, and they've been treated with it and they do well. And I've had patients that had a peripheral nerve entrapment and they've done well with it because they didn't want to undergo surgical intervention. It's also an option. So there are some ways to treat neuropathy, but a lot of times it's just something that patients are going to live with. I would be remiss if I didn't say that for diabetics who have neuropathy, it's well established that once they get their sugar under control, they can have a partial or complete reversal of the neuropathic symptoms. Patients who have surgical intervention on their back, oftentimes they no longer have neuropathy. If they don't have surgical intervention, but they do physical therapy and they keep their core very strong, a lot of times that will put an end to their neuropathic symptoms. And even if it doesn't put an end to it, a lot of times it will diminish the symptoms to such a degree that they're fine. They'll just know that it's there once in a while. They'll get some reminders. That's the scoop on neuropathy, but it's a little trickier problem than your average ankle sprain. Okay, so that concludes our top 5 questions of the week. I want to thank everybody for watching and subscribe to the channel. You can click on the links below. If you're having any of these problems or any other foot or ankle problem and you want an opinion, you can schedule an appointment in our virtual clinic. We recently launched the ankle and foot virtual clinic, and so that's on Wednesdays. So if you wanted to talk to me about something that's going on with your foot and ankle and you want an opinion or a second opinion from another doctor, whatever it might be, I'm happy to help you out any way I can. Just give us a call, schedule an appointment, and I'll look forward to hearing from you.